Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Cancer Buzz is reporting this week from Washington, D.C. at the ACCC 50th Annual Meeting and Cancer Center Business Summit. That's right, ACCC is celebrating 50 years of research, trends, and resources for oncology professionals, and 50 of these events that bring oncology leaders together from all across the nation to share and collaborate on cancer care's biggest challenges. We're here with ACCC advisory member Wendi Waugh. Wendi's the administrative director of the SOMC Cancer Services and Ambulatory Infusion at Southern Ohio Medical Center. Wendi, it's so good to see you and catch up.
Oh, it's so good to see you again, Summer. Nice to be here.
Obviously, you haven't been attending this event for 50 years. How long have you been a part of ACCC, and how many of these meetings have you attended?
What a great question. You know, I think I've been involved with ACCC, I'm going to say 10 to 15 years, very heavily involved in the last 10 years. Part of the board of trustees and been involved in, the fan network and several other different projects. But yeah, 50 years with ACCC, that's amazing.
Can you imagine what we were talking about 1974 at this summit?
I can't. I really can't. But I have been actually in oncology care, and I know I sound really young, like I have my podcast voice on, but I have been working in oncology for 35 years. So actually, I kind of remember a lot of these 50 years. But I did a little research, and, we are in 2024. And so 50 years ago, in 1974, we passed legislation to broaden the NCI award for grants and research. What about that? And where are we today, Summer? Think about it. All the molecular therapies, precision medicine, all these access to care, social determinants of health, CAR T therapies. Wow. So yes, we were doing radiation therapy and chemotherapy and surgery for cancer 50 years ago, but wow, where we've come and what we're doing now really for personalized medicine.
Right, I wonder if they could even imagine that at the very first AMCCBS. Wendi, you serve on ACCC's Financial Advocacy Committee. Tell us about that committee and the resources that the Financial Advocacy Network provides for cancer centers.
Yeah, so I got involved in that committee, I'm going to guess about 5 years ago. And I'm going to tell you, I felt like a fish out of water. So I'm this administrator, and I'm surrounded by these extremely knowledgeable people in the finance world of helping people get prior authorizations and using programs to find patient assistance programs. And I was listening, and I was in awe. And I was like, my gosh, I'm running an oncology program, and I don't know about this stuff, and my center isn't taking advantage and doesn't have these financial advocates in our patients are not benefiting by this. So I got involved, and we have done so much over that period of time that I was involved. The financial advocacy boot camp already existed, but we revamped it. We've written lots of flows and charts to help people just kind of follow. If you have this insurance, do this, then do that. And then I can't wait to talk about the financial advocacy guideline assessment tool.
Well, let's talk about that. So there are a number of resources that you just mentioned on the website. When you look for Financial Advocacy Network on the ACCC website, there's so much there. You can access a financial advocacy toolkit. There are how-to guides on fighting financial toxicity and improving the prior authorization process. But there's also the financial advocacy guidelines. Tell us about those.
Yeah, I'm going to tell you about those, but I'm going to go back to one thing that you said right there, and that is how to. So you asked me, how long have I been involved in ACCC? And I didn't tell you why. And why is because it is the how-to organization. It has made such an impact in my life as a cancer center administrator. It has connected me to so many different professionals, from financial counselors to social workers to nurses, advanced practice providers, physicians, and we problem solve together and talk about it. And then ACCC launches these documents or these how-to guides into how to do it. So the financial advocacy gap assessment tool is for every center to assess what resources you have to take the patient, to relieve some of those financial barriers so that they can be compliant and successful in their treatment plan.
The FAN, which stands for Financial Advocacy Network,
Yes.
gap assessment tool was also recently launched for ACCC members. What is that process like? What can cancer centers learn?
So I just did this for my center. Even though I was a part of the development, I think if you're out there in healthcare, you've heard of Joint Commission, or you have heard of ACR accreditation or QAPI. This gap assessment tool is essentially that, in that it allows you to take certain standards and it allows you to look at those resources, those items within your center, and evaluate the level to which you do or don't provide them. The great thing is that nobody's saying that, oh, you get an A. Like, right? We all want an A on our test, or we want to pass all the standards. This is your assessment tool, everyone out there, to use to evaluate what are you doing for financial advocacy and where are your gaps. And then you can take those gaps and create that roadmap to improvement and bringing those resources to the patients.
Thank you, Wendi. Enjoy AMCCBS.
You can see how passionate I am about it, Summer.
You are. We love it. You can find more resources for the Financial Advocacy Network in the show notes. That's it for today. Follow along right here on the Cancer Buzz channel all this week for the latest announcements and updates from the 50th AMCCBS. I'm Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.